Chapter 9 deals with obstetrics and neonatology. So this area focuses on taking care of a mother when she's pregnant, in labor, and after delivery, as well as taking care of the newborn baby itself before and after birth. And then we're going to get a little bit more into what all of that really entails. This is the last chapter in this unit of chapters 6 through 9. The term obstetrics is the branch of medicine that specifically deals with childbirth, so a mother giving birth to a child, and taking care of the mom both before and after birth. So this includes all the way from finding out that the woman is pregnant till after delivery. Obstetrics is abbreviated OB, so females often go see an OB when they are pregnant. The other key term here is neonatology, and this is the branch of medicine that deals with the newborn. So it diagnoses and treats disorders of the newborn both before birth and after birth. And if you look at the word neonatology, neo means new, and so that kind of can give you a clue as to what that is focusing on. Before we get into the medical terms, it's important to have a number of vocabulary words kind of understood, and there's a lot that deals with pregnancy. So some of these words are actually, from biology class. We have gamete, which is a mature germ cell. For a male, that's a sperm, and for a female, that is an egg, or ovum, if you will. Then we have ovulation, which is the expulsion of a mature ovum. So, once a month, a female kicks off or expels an egg out of the ovary, and then it will travel down the fallopian tube and in through the uterus. And if that egg is not fertilized, which is the next term, then it will be expelled through the body through the menstruation cycle of a woman. Conception or fertilization, both of those words mean the same thing, and that is the initialization of pregnancy, is when the sperm fertilizes the egg. At that point of fertilization, you have a zygote. A zygote is the cell that is formed once the sperm fertilizes the egg or ovum. And then it will turn into an embryo. After a certain number of cell divisions, the fertilized egg, which is the zygote, travels and then will implant itself on the uterine wall. And once it sticks itself on the uterine wall, it will continue to grow, and that's when it's called an embryo. And it is considered an embryo until the 8th week of pregnancy. So 2 months or 8 weeks, the unborn life, if you will, is considered an embryo. After 8 weeks of pregnancy, from then on, from the beginning of the 9th week until the baby is born, it is called a fetus. So they don't really use the word baby until after birth. So there's zygote that turns into an embryo that turns into a fetus. The term gestation or pregnancy is basically the amount of time that it takes from fertilization to birth to successfully, develop the new infant to full term. And for a human, that's 40 weeks. Different animals have different, times of length for this. And I already mentioned kind of on the last slide, implantation is when the zygote implants itself in the uterine lining, and that means that it's going to then grow and develop in the uterus and eventually turn into an embryo and a fetus. And just note here, 40 weeks for a human is what translates into roughly 9 months, or 3 trimesters, if you will, is kind of how they break it down into three-month sections. All right, now kind of getting into some of the anatomy terms here. We have the placenta. It's also called the afterbirth because when a female has a baby, the baby comes out and then the female actually delivers the placenta also, so that's kind of why it's called the afterbirth. But it grows on the wall of the uterus, and it is responsible for nourishing the unborn child. So as you can see kind of in the picture, it's surrounding the baby, and then you can see all of those blood vessels. So the female's blood, the mom's blood, is kind of feeding into the unborn child through the placenta. There's also the amniotic sac, and that's basically the membranous bag that surrounds the fetus before it's born. And you can see in the picture, it looks blue, and inside the amniotic sac is filled with amniotic fluid, which is just like the liquid that the baby is floating around in. And the whole thing is just kind of a sac, and as the baby gets bigger, that, there's less room to move around, less free fluid, and so on. And there are a number of layers to this amniotic sac. The amniotic fluid is kind of within the sac, but the chorion is the outermost layer of that membrane, seen in kind of a red picture here. And then there's the amnion, which is the innermost. And these terms will come into play a little bit later on. Here's a visual representation of kind of how pregnancy really begins. So it starts with a female ovulating. So that, as you can see in the picture on the right hand side, during menstruation, one ovary will kick out an ovum. So in this case, it's the right one that we're seeing here, or the mom's left if you want to take it anatomically correct. But it kicks out a gamete or an egg, and that egg will begin to travel up through the uterine tube. And if there is sperm there, so in theory, sex has taken place before this, and the sperm, sometimes it can take days, travels all the way up through the vagina and the cervix and the uterus and down, usually into the fallopian tube or uterine tube, and magically one of them finds the egg and fertilization takes place. And so usually fertilization will take place in the uterine tube, but there are instances where fertilization can, take place later if the egg has traveled its way down to the uterus already. There are instances where fertilization can take place there, but most of the time it happens in the uterine tube. And then after that fertilization, the cell begins to grow and divide, and at that point it is a zygote. And so that little zygote is going to travel its way down into the uterus, and it will hopefully find a nice little spot on the wall of the uterus, and it will implant itself. So it will latch on, and at that point it's considered an embryo, and until the 8th week of pregnancy is over, then it will turn into a fetus. There are instances where that zygote does not attach to the uterine wall, and at that point the woman would just, menstruate, and it would leave the body. It really isn't considered a miscarriage at that point, just because there was no implantation, and we'll learn about what a miscarriage is later. But that's kind of, I guess you were pregnant and didn't realize you were pregnant, and it was all over before it started. Many of you really haven't seen fetal pictures before, so this is just to give you a glimpse of what, that might look like. This is an example of a 13-week-old fetus. So it has transitioned from an embryo to a fetus, 68 days old, and you can see that it's kind of starting to look like, a human boy. And usually the ultrasound people won't tell the mother whether or not it's a male or female, usually until week 20 to be certain, but you can tell roughly as young as 12 weeks. All right, now we're to the point where we can actually use some medical terms, and then we will apply them to diseases and disorders. All right, so looking at this list, it is in your book on page 347. We have amnio and amniano. Both of those mean the amnion, or specifically the amniotic fluid. It could be referencing the sac itself or the fluid inside. Choreo is for the chorion, that outer layer of the amnion. Embryo is pretty straightforward, embryo. And feto and feti means fetus or unborn child from, that 9th week on. And notice that both the O and the I vowel is used, and that's going to be depending on, what you stick with it. Gravido sounds really nothing like it is, but gravido means pregnancy. So when you're talking about a woman being pregnant, whether it's pregnant for the first time or pregnant for the 20th time or whatever, pregnancy is referenced with gravido. Lacto, like lactose. Lacto means milk. I always think of lactose intolerant, means you can't drink milk. Nato means birth. So if you look at neonatology, for example, we know neo means new, so neonatology would be the study of new births or babies. Omphalo, O-M-P-H-A-L-O, the PH sounds like an F. Omphalo means the umbilicus or the navel, basically your belly button. The scientific word for your belly button is umbilicus. Pero and parto means a bunch of stuff. It means to bear, to give birth to, labor, or childbirth. So in common medical practice, pero and parto reference usually the childbirthing process or the labor itself. And then pulpero also means childbirth. So we're going to get into a little bit of tricky understanding because pero and parto means childbirth, but peripero also means childbirth. And I'll try to point out the differences a little bit later on. If you have a diagram, go ahead and label it, and that way you can use that as a study tool. Alright, so now that we have the anatomy, these words are going to be used with those anatomical words. Cephalo, we've actually seen that one before. Cephalo means head. Esophago means esophagus. And you'll see a little bit later on why we incorporate, these type of anatomical terms in this unit. Because there's a great number of diseases and disorders that can affect unborn and newborn babies in these areas. Pelvi and pelvo usually references the pelvic bone or the pelvis. Primi means first. So if you're thinking about, a woman's first child or first pregnancy, that's going to come into play. Pseudo means false. There is something called a pseudo pregnancy, and I'll explain that in a little bit later. Pyloro means pylorus, or in this case, the pyloric sphincter. If we remember back to the digestion chapter, a sphincter is a muscular closing that's job is to basically prevent backflow. So the pyloric sphincter connects the bottom of the stomach to the beginning of the intestines, and it helps to prevent the backflow from the intestines back into this. Oh, excuse me, I don't know what I'm talking about. The pyloric sphincter prevents the backflow from the stomach up into the esophagus. Excuse me. The last term here, terito. Terito means monster if you translate it literally, which is where this word comes from, but it means malformation. So if there's any type of abnormal development or malformation in the fetus, for example, they might use this term. Alright, so prefixes that we're going to be using here, we've seen most of them before. Anti and pre both mean before. For example, pre-eclampsia, and we'll learn what that condition is a little bit later on. It's basically a condition that comes before eclampsia. Micro means small. For example, microcephalus is the condition of a small head. Multi means many. In that multigravida, for example, we learned gravido means pregnancy or pregnant. So multigravida just means that the woman has been pregnant multiple times. For example, myself, I have 2 children, so I was multigravida. Nulligravida, or nulli, means none. So I'm assuming that most or all of the females, in this class have not been pregnant before, and that would be a nulligravida. Post is after. For example, postpartum. Parto means childbirth, so postpartum would be after childbirth. So after the mother has given birth to the child, it's that time period. Here are the suffixes for this unit, and you'll notice that most of them have no meaning whatsoever. So if you look on the slide, we have E, IS, UM, and US. All of those have no meaning whatsoever, but their purpose is to turn whatever word you're forming into a noun. So we looked, on the previous slide, for example, we had postpartum. So that would be, after childbirth. The has no meaning, but it turns the word into a noun so you can use it like one. Other suffixes, amnios means the amnion or the amniotic fluid, and we already had the combining forms for this that mean the same thing. And so it just depends on what we're sticking it with, whether we use the word root that means this or here the suffix that means this. Saisis means pregnancy. So when I mentioned that there was something called a fake pregnancy, pseudo-saisis is an example, or false pregnancy. Rhexis, note the EXIS, excuse me. But note the RRH. Rhexis means rupture, but we've seen that RRH before in word suffixes like ria, regia, raphi. So when you're talking about a suffix, kind of when in doubt, it's 2 R's. Tosia. Tosia means birth or labor. So this is kind of talking about the actual labor and birthing process. For example, dystocia. Dys means difficult or painful. So dystocia would be a difficult or painful labor or delivery. I don't know what woman giving birth wouldn't say that it was painful, but it would be, I guess, extraordinarily painful above and beyond what you should be experiencing. So this slide is just kind of to combine or review all of the word parts that basically mean the same thing or similar things. Nato means birth, but usually we're going to be using nato when we talk about the baby after birth. Pero and parto means labor, or usually like the process of going through labor to give birth. And the suffix part of that is tosia, which means roughly the same thing. We also have porpero, which means childbirth. All right, which 2 of the following words mean pregnancy? Either gravido and saisis or pero, parto, and tosia. Hopefully you came up with A. Gravido and saisis both reference pregnancy, whereas pero, parto, and tosia all reference the labor or birthing process. All right, so the beginning list here of diseases and disorders, there really aren't that many. Starting off, we have amnionitis, so inflammation of the amnion, which would be the inner lining of the amnion sac itself. You can also have chorioamnionitis, which would be inflammation of both the amnion and that outer layer, the chorion. There's choriocarcinoma. If we remember from way back when, a carcinoma is a cancerous tumor, in this case of the chorion. Dystocia, I mentioned before, would be a difficult or painful labor, and that usually occurs in about 10% of all, childbirths is considered dystocia. Next, we have hysterorexis. So both of these word parts are from previous chapters. Hystero means uterus, and rexis means rupture. So this would be a rupture of the uterus. Then we have oligohydramnios and polyhydramnios. Both of these terms reference how much water or amniotic fluid is in the sac. So if there's too little, which is anything under 500, it's considered oligohydramnios, and if it's over 2 liters worth, it's polyhydramnios. Go ahead and take a moment to work on exercise 13 before we move on to the ones not built from word parts. Alright, so the diseases and disorders not built from word parts. The first one is abortion, abbreviated AB. And that is any type of termination of pregnancy, usually happening before 20 weeks. So anything up to the halfway point of a full-term child. There are different types, and your book kind of goes through them on page 353. Spontaneous abortion is also called a miscarriage. So that's when this occurs naturally. For whatever reason, the embryo or fetus, didn't stay on the uterine wall and therefore is expelled. You can also have induced. An induced abortion is one that is, done on purpose, and there's two different kinds. There is therapeutic. Therapeutic is one that's performed on purpose or intentionally because of the health risks to the mother or fetal disease. For example, if the mother is not well enough to take the baby to full term without causing, fatal death to herself, or if there's genetic testing done on the fetus and they find out it has some kind of terminal condition due for a life of, pain and early death, and the family decides to, abort the fetus. That would be considered therapeutic. The last is elective, and elective is performed by the request of the woman. So that's kind of the most typical one that you would think of if, a woman is having an unwanted pregnancy and wants to terminate. The next term here is Abruptio Placentae. So as you can kind of gather, it centers around the placenta, and in this case the placenta itself, which is normally attached to the uterine wall to kind of maximize space for the baby to move around in, the placenta prematurely detaches from the uterus, and that can cause all kinds of health issues. I'll show you a picture on the next slide. Eclampsia really goes along with preeclampsia. This is a crazy condition that doesn't really have a known cause, but preeclampsia can occur either during pregnancy itself or, right after the woman has given birth. It's characterized by really high blood pressure, as well as other things like edema, proteinuria, meaning there's proteins in the urine, but no convulsions or seizures. If there are convulsions or seizures, then that's considered eclampsia. And, if treated right away, then the female has a good chance of survival and full recovery. Otherwise, it can lead to maternal death. It's actually the third most common cause of the mother to die after a hemorrhage during delivery or infection. And infection is usually more for C-sections than traditional birthing. We also have ectopic pregnancy. In this case, a few slides ago I talked about how the zygote, makes its way down the uterine tube and then it will implant on the uterine wall. An ectopic pregnancy is where that zygote decides to plant itself somewhere other than the uterus. In this case, usually it's in the uterine tube. So for this disease, it doesn't travel all the way down the uterine tube and make its way into the uterus. It will implant and grow in the uterine tube. And as you can imagine, there's really not a whole lot of space in there. So as the embryo gets bigger and grows, then there's all kinds of health issues related to that. Placenta Previa is the next one, and that is an abnormally low implantation of the placenta. And I'll show you what that looks like in a little bit, but basically it's so low that it's kind of covering the opening into the cervix. So when a woman is going to be going to give birth, traditionally the baby comes out first and then the placenta. However, the placenta in this condition is low and is basically covering the opening, so the baby can't get out without rupturing the placenta. And if the placenta ruptures, then that can cause the mom to bleed to death, because that's kind of the main blood supply for the baby. Okay. Here's what Abruptio Placentae looks like, where the placenta prematurely detaches away from the uterine wall. So on the left, that's kind of happy and healthy there. You see the placenta kind of on the left side. The amniotic sac is taking up the rest of the uterus, and the baby is, happy, healthy. In the middle, you can see kind of the beginning of that detachment, and you can also see that the amniotic sac is kind of pulled away from the outside of lining of the uterus as well. So the baby is kind of smushed. And then even more so on the right, and that can lead to premature delivery, issues with delivering nutrients to the baby, and so on and so forth. Here's an example of what ectopic pregnancy might look like. As I mentioned, here we have the zygote, instead of making its way down the uterine tube into the uterus for implantation, it decided to implant itself right in the uterine tube. So as it turns into an embryo and grows and divides, obviously it's putting pressure on the uterine tube that could cause that to rupture, or could cause, other issues. These three pictures are examples of Placenta Previa, where the placenta is abnormally low, whether it be on the left where it's kind of fully covering the cervix, but it's also pretty covered on the cervix in the middle picture and the right picture. So if the woman is about to give birth and the cervix is widening there at the bottom, the placenta is blocking the baby's way out, and that can lead to a lot of bleeding and potentially fatal heart or fatal bleeding issues for the mother, and health risks for the baby as well. Okay, so these are the ones that are related to neonatology, so focusing kind of on the baby. We have microcephalus, so the condition of having a small head. Umbilitis, if you remember, umbilico means the umbilicus or the navel, so here we have inflammation of that umbilicus. You can also have umphalocele. Cele is a protrusion or a hernia. So an umphalocele would be protrusion or hernia of the umbilicus. And you can see a real picture in your book on page 357. But it's kind of where the intestines push out through the very weak umbilicus of the newborn child. Okay, so next we have pyloric stenosis, and this actually occurs in roughly about every 1 in 200 births, but it's congenital narrowing of the pyloric sphincter. So basically it can't really do its job, and it can't efficiently prevent, backflow, and that's why kind of projectile vomiting and all kinds of issues can take place in newborns with that condition. Finally is tracheoesophageal fistula. A fistula is an opening between two areas or organs that aren't supposed to have an opening. Here we're referencing the trachea and the esophagus. And think about what the trachea does and what the esophagus does and why there would really be an issue with having a passageway between them. The trachea is, the mode by which we breathe in our air, whereas the esophagus is kind of the mode by which we take in food. So, for example, an infant with this condition would go to drink milk, and the milk would end up going in the lungs, and that kind of thing. So obviously, very big issue to occur that can be, reversed with surgery. So looking at this picture is a hernia of the umbilicus. You can see how in that umbilical area, that's the intestines there. Surgically speaking, they would just kind of push all that back in and stitch it up. But what is the correct term for this? A or B? Correctly, hopefully you chose A. The only difference between the two words is that O combining vowel that is necessary. Here we have the diseases and disorders for the fetus or newborn baby that are not built from more parts. The first one is a cleft lip, also cleft palate, and in this condition the lip, the upper lip, and sometimes the roof of the mouth has a split, so it never kind of fused together like it's supposed to. There's a picture in your book on page 358. But it's a pretty common condition that can easily be fixed with some, small surgery and stitching. But it is a congenital condition, so the baby is born with this. Next we have Down syndrome, and this is a genetic condition caused by a trisomy of the 21st chromosome, so there's an additional 21st chromosome, and that kind of extra gene dosage then manifests itself in varying degrees of intelligence issues, developmental issues, physical disorders, or defects. Next we have erythroblastosis fetalis, and if we remember, a erythrocyte is a red blood cell. So this is a condition where the baby's red blood cells lyse or break. And the reason this could occur is because the mother's blood is not compatible with the newborn baby's blood due to something called an Rh factor. And if you want to go into that, just let me know. But you can either be positive or negative in your blood for this Rh factor. And if the mom and child are not compatible, then when the blood mixes, because obviously the mother is, blood is running through the fetus while the mother is pregnant, it can cause this condition. Esophageal atresia. Atresia is wherever there is an absence or a gap. In this case, there is a congenital absence within the esophagus. So the esophagus normally travels from, your throat all the way down to the stomach, but if for some reason there's a gap there, then you have this condition. And obviously that's an issue because you can't, eat if you don't have a full esophagus. Fetal alcohol syndrome, FAS, is a completely preventable condition, but it's caused by the mother drinking or consuming alcohol while she is pregnant. And that can cause a bunch of birth defects, including malformations in the skull and the face, as well as central nervous system issues. Gastrochisis is the next term. Chisis is a fissure or kind of an opening. So gastrochisis here is a congenital issue with the abdominal wall. It could also be called an enterocele, but basically it's similar to a umbilicocele, where the intestines kind of pushed out through the umbilicus. If it doesn't happen exactly at the umbilicus, they call it a gastrochisis. So their abdominal wall is particularly weak or hasn't fused fully, and that causes pressure that can then have the intestines and other internal organs kind of push their way out. Next, we have respiratory distress syndrome, and this is a complication with brand newborn babies, especially premature infants. The lungs are kind of the last organ to really fully develop and getting prepared to, take on the outside world. And the immaturity in that system, when premature infants are born, they can't really expand their lungs fully and breathe well. So that's why it's called respiratory distress syndrome. Finally, spina bifida. This is a congenital defect of the vertebral column. So during normal development, the vertebral column kind of circles up and closes. In this case, that did not happen, and so the meninges, or part of the spinal cord, kind of protrude out, and it could be just the meninges or the spinal cord, but we talked a little bit about what those protrusions specifically are in Chapter 15, but they kind of push their way out through the vertebral column, and as you can imagine, cause all kinds of issues. So here's an example of what the cleft lip / palate looks like. It could just be a cleft lip. You can kind of see the palate is that upper part or upper roof of the mouth. It could be in one or both areas. This is a very common condition in lesser developed countries. Here's what esophageal atresia looks like in cartoon form. You can see the gap between the top of the esophagus and the bottom of the esophagus leading into the stomach. In this case, the baby would have to be fed through a either an IV or a feeding tube into the stomach, kind of through the abdomen, and then they would go in and usually you can kind of stretch or reconnect the esophagus or implant something to join those two ends. Here's the book example of what gastrochisis is. Again, it's whenever the abdominal wall has kind of failed to fuse correctly and therefore is extra weak and prone to internal organs coming out. And this really occurs anywhere that's not the umbilicus. If it occurs in the umbilical area, then it's considered an umbilicocele or umbilical hernia. So this is an example of what spina bifida looks like in an infant. And you can see it in cartoon form kind of on the left there. The vertebral column failed to, fully fuse where it's supposed to, and so it gives the opportunity for the spinal cord and meninges to kind of push their way out through that opening. And then you can see what that looks like in the infant on the right. Alright, so now we're getting into the surgical terms, in this case the obstetric ones, so kind of dealing with labor. An amniotomy is the first, and that translates to an incision into the amnion. And the reason that this is done is it's basically an intentional breaking of the water. They pop the water. I guess I should say breaking water is whenever the amniotic sac breaks open, and that's usually the initial step in the act of, inducing labor. So once a woman's water has broken, then labor and birth is on. There's kind of no going back from that point. So if they are purposefully inducing labor, which is increasingly common now, especially if a woman kind of hits her due date and the baby has not come out yet, they will oftentimes schedule an induction. And this is one way that they do that, is to purposefully break the woman's water to kind of get things going. The other term here is episiotomy. And if we remember, epizio is the vulva, and this would be an incision into the vulva. And you might ask yourself, why would you purposefully want to cut or make an incision in the vulva? But think about a woman giving birth and squeezing a child through a very tiny opening. Oftentimes that can cause tearing, depending on how big the baby is in relation to the mom. It can cause tearing and other issues. So sometimes, in an effort to lessen recovery for the mother, they might do an episiotomy where they purposefully cut the vulva so that the line cuts are nice and straight and much easier to heal later than having a traumatic tear. All right, in terms of diagnostic imaging, the first is pelvic sonography. Sonography is the fancy word for ultrasound. So in this case, they are looking at the pelvis area, and this is what they use to evaluate the fetus in pregnancy, and that's how you get all those ultrasound pictures and whatnot. There's also something called amniocentesis. Centesis as a suffix means to aspirate fluid. So in this case, they're doing it from the amnion or the amniotic sac. They inject a giant needle into the woman's belly, and they suck out a little bit of the amniotic fluid. And then they use that fluid to, run tests, for example, to look for certain genetic diseases. And during that procedure, they do an amnioscopy using an amnioscope. The scopy is the process of, visually examining the fluid after it's obtained, and this is done with an instrument called an amnioscope. So here's an example of what a pelvic sonography looks like, or sonogram, also known as an ultrasound. And you can see the, fetus. You can see the head, the nose, the outline of the body. You can even see some internal organs in the head, for example, as well as, bones in the body. This is the cartoon picture of what amniocentesis looks like. So you can see the giant needle that gets stuck in through the female's pelvis. It gets guided using an ultrasound transducer that helps guide the needle into the amniotic sac, and then it will suck out a little bit of the amniotic fluid. Obviously, this is very, careful procedure. They don't want to injure or damage the baby, and then they use that fluid to test for different diseases. This is not something that is, mandatory in every pregnancy. It's really an optional screening most of the time. For example, I did not have this done with either of my two children. Okay, now we're to the complementary terms, and there is a bunch of them. So starting off, we have amniochorial, which means pertaining to the amnion and the chorion. Then we have amniorrhea. If you remember, rhea means discharge. So there is discharge of amniotic fluid. Some of it might have leaked, for example. Amniorexis is when the amnion actually ruptures. You could also use this term for the water breaking. Antepartum means before childbirth. So this is usually in reference to the mother before she gives birth. You can also have intrapartum, which is later on in the slide, which is during childbirth. And then on the next slide, we'll have postpartum, which is after childbirth. Embryogenic just means that there is producing an embryo. Embryoid means resembling an embryo. Fetal means pertaining to the fetus. Gravida means pregnant. So this is a woman who is pregnant or has been pregnant. And it's important to know that it's regardless of the pregnancy outcome. So it's sad to say, but there are a number of women out there who have been pregnant, but then maybe had a miscarriage or for whatever reason had to terminate and didn't have a viable offspring. They could still be considered gravida. Gravidopuerial is pregnancy and childbirth, and this covers kind of the entire time from childbirth all the way until the woman's reproductive organs return to normal. So after childbirth, everything doesn't just, magically snap back into place. It takes, 6 to 8 weeks for everything to kind of go back to normal. Lactic would be pertaining to milk. Lactogenic would be producing milk. For example, the mammary glands are lactogenic. There's also lactorrhea, which would be spontaneous discharge of milk. So for example, the mammary glands, if a mother hears their baby crying, for example, it often stimulates the discharge of milk. There is multigravida, so multiple pregnancies. So this would be an example of anyone who's been pregnant 2 or more times, again, regardless of the outcome. Multipara is many births. So para is referencing the birth. So a woman who has given births many times, 2 or more times, to viable offspring. So para means that you have given birth to a viable offspring. And then natal is anything pertaining to birth, usually referencing the newborn. All right, continuing on with the list, we have a neonate, which is referencing the newborn baby anytime between 0 and 4 weeks after birth. Then we have a neonatologist in neonatology. So this is the person and field of study that is surrounding the newborn infant. So they treat the disorders of that newborn infant. Nulli gravida means that a woman has not been pregnant before. Nullipara means that they have not given birth before to a viable offspring. So keep in mind it is possible to be pregnant but then not give birth to a viable offspring. Para just means birth, so any woman that's given birth after the point of viability. So this is any woman who's given birth after 20 weeks of age in the fetus, whether the baby survived or not. Postnatal is after birth, usually in reference to the newborn, just like prenatal is referencing the newborn before birth. Postpartum is after birth, mostly speaking about the mother after birth. Primigravida is first pregnancy. Primipara would be first birth. Pseudocyesis is that false pregnancy I talked about previously. It's kind of a psychological condition where you think you're pregnant, so much so that your body actually begins to kind of manifest symptoms of being pregnant. So you might, gain some weight, have all those kind of hormone issues and so on. Pepera references the childbirth process or a woman who's just given birth. And puerperal is pertaining to, immediately after childbirth has taken place. Teratogen is any substance that causes a malformation in the child, whether it is a drug or a chemical or environmental factor. Teratogenic is something that produces these malformations. So the drug is a teratogen, but it could be teratogenic if it causes a malformation. And then the field of study which focuses on treating these disorders and malformations is called teratology. This is just kind of a compiled list of the terms. It's in your book too, to try to help you keep all of them straight, of when you're talking about the mom or the baby before or after childbirth. So if you have natal, we're talking about the newborn. If it has partum, you're talking about the mother. There's also terms here for pregnancy and birth. Again, this is just to kind of help you keep them all straight. Here are the complementary terms not built from word parts. There's a bunch of them. So the first pair has to do with the presentation of the fetus as it's about to be born. Breech is where the feet are set to come out first. Cephalic presentation is when the head is going to come out first. A cesarean section, or a C-section as it's called, is one method of delivery. There is an abdominal incision that is made through the stomach and through the uterus, and the baby is kind of pulled out that way, avoiding a vaginal delivery. And this might be due to the size of the infant, other health conditions, as well as it's kind of increasingly common for females to select this option and avoid a vaginal delivery. Colostrum is the first substance that a woman's mammary glands produces. So it comes out before their milk fully comes in. It's very high in nutrients for the newborn baby. A congenital anomaly is anything that a baby is born with. This is going to be usually picked up on the sonograms, as well as possibly amniocentesis. But it is anything that the baby's born with. In vitro fertilization, or IVF, is a method that couples who are having trouble getting pregnant utilize. This is where the egg and the sperm are mixed together outside of the female, and then once a zygote is formed, they are then implanted into the uterus, and hopefully it will implant into the uterine wall, and that the woman will become pregnant with the child. Lactation is producing milk. Lochia is all of the discharge that a woman has after childbirth. So as the female organs begin to go back down to normal size and the uterus shrinks back down to normal, there's a large amount of discharge, and that's what that's called. Meconium is the first stool coming out of the baby. So as the baby is, in the uterus and growing, it's actually forming a stool that will then come out after the baby's born. It's this kind of black, gross, tarry substance. A midwife and midwifery. This is the person and branch that is most often used by women who don't want to give birth in a hospital, but they assist in the delivery and kind of help. They may or may not be actually registered nurses. Obstetrician and obstetrics. This is the person and branch of medicine that deals with pregnancy, childbirth, and the mom after she delivers. Patrician is the actual act of giving birth. A premature infant. Any baby that's born prior to 37 weeks or 3 weeks early is considered a premature infant. Puerperium is the period of time that a woman's organs need to kind of go back to normal after giving birth. This usually takes about 6 weeks. Quickening is when the mom can first begin to feel the baby, or fetus, I guess, moving around. Usually this is somewhere between 16 and 20 weeks of gestation. And stillborn. Stillborn is when the baby is born, is born dead. And that could be from a number of different medical issues or reasons. Antepartum and postpartum refer to the birth or the mother. Okay, well, hopefully you come up with the correct answer. A, birth. Before birth is antepartum, after birth is postpartum. Here are all the abbreviations for the chapter. There's really not too many, and most of them kind of go along with what they are. You will be responsible for knowing these come test time. Just like every chapter, please make sure you try to put some of this into practice by reading actual medical text. One, being able to pronounce the words correctly, but also being able to go through and understand the context of the situation.